Have you noticed someone close to you gradually exhibiting subtle yet worrisome changes over the past year? Many people think that when someone dies of old age, it's a sudden event. But in reality, the body often gives us quiet signals, months, and sometimes even a year before reaching life's final chapter. The issue is that most of us miss these warning signs because they're easy to overlook in the beginning. It's only upon looking back that families realize those clues had been there for quite some time, but by then, there's no time left to make preparations or create those precious final memories. Today, we're diving into 5 key signs that often show up within the year before an elderly person passes away. Some may be things you've already observed, only to dismiss them as normal aging. Others might seem small, but can actually point to the body's slow decline. If you learn to spot these signals early, you'll have a chance to give better care, treasure important moments together, and most of all, ensure your loved one's last days are filled with comfort, dignity, and peace. Stick with us. These 5 indicators can help you get ready, emotionally and practically, for what's ahead. With this knowledge, you won't be caught by surprise. You'll be able to truly make the most of every remaining day with those you love. Let's begin with the first sign: significant weight loss. One of the earliest and most revealing indications that someone could be approaching their final year is losing weight unintentionally. It might start out subtly: a belt needing another notch, clothes fitting looser, or a once robust appetite dwindling. Many families shrug this off as just another part of getting older. However, the reality is that unexplained weight loss is seldom a good sign. It usually means the body is no longer properly absorbing nutrients, muscle mass is shrinking, and vital systems are winding down. Though some muscle loss is typical with aging, rapid changes signal that something more profound is going on. The body may struggle to digest food efficiently, and it might not process protein well anymore, leading to muscle wasting and increasing weakness. This loss of strength doesn't just affect movement, it also raises the risk of falls, weakens the immune system, and heightens vulnerability to infections. Another factor contributing to weight loss in the last year of life is a change in appetite. Many older people just don't feel hungry like they once did. Their sense of taste dulls, food becomes less appealing, and they may skip meals or eat much smaller amounts. This isn't simply a change in preference. It's a deep physiological shift. As the body starts to slow down, it stops sending hunger signals to the brain as it once did. The result is less energy, less strength, and a gradual overall decline in health. On top of this, chronic health conditions also play a role. Weight loss is a common symptom in diseases like cancer, heart failure, and kidney disease, of which can start causing problems long before more obvious symptoms show up. Even issues like depression or cognitive decline can lead to poor eating habits, causing a downward spiral where the body simply isn't getting enough fuel to keep going. Some families try to address the problem by encouraging their loved one to eat more, offering favorite dishes or supplementing meals with protein shakes. But if the weight continues to drop despite these efforts, it's crucial to realize that it's not just a dietary issue. It's the body preparing for a more significant transition. At this point, forcing large meals may not be helpful. Instead, comfort, easy-to-eat foods, and hydration make a bigger difference in helping maintain quality of life. If you notice considerable weight loss, less eating, growing weakness, or trouble staying active, recognize that this is more than just changes in appearance. It's a message from the body. Understanding this message now can help you approach the future with compassion, wisdom, and the chance to make the remaining moments as meaningful as possible. On to the next sign: intense fatigue and weakness. In the year leading up to the end of life, one of the most evident shifts is a deep, ongoing tiredness that doesn't go away, no matter how much rest your loved one gets. This isn't just feeling a bit worn out. It's a profound level of exhaustion where even simple activities become overwhelming. Just getting out of bed can feel like a huge effort. Tasks that used to be routine, like making a meal, getting dressed, or even holding a conversation can suddenly seem too hard. This is more than the usual slowing down of age. It's the body holding onto its last reserves of energy as major organs begin to function less efficiently. The heart doesn't pump as strongly, blood flow slows, and muscles aren't oxygen they need. This is why elderly people in their final months often feel weak and shaky, unable to keep up with the level of activity they once enjoyed. Another piece of this puzzle is metabolic slowdown. Normally, the body creates and uses energy for movement and activity, but as the end approaches, energy is redirected towards simply sustaining life. Rather than fueling movement, the body focuses on preservation. As a result, those in decline tend to sleep more, take longer naps, and have a harder time staying awake for long stretches. There may be sudden drops in energy fine one moment, totally drained the next. Perhaps the hardest part is the emotional toll of fatigue. Seniors who once took pride in their independence might feel frustrated, ashamed, or embarrassed at not being able to do what they used to. They may withdraw from socializing, avoid conversations, or stop participating in hobbies not from a lack of interest, but because they just don't have the energy. This starts a cycle of isolation, further speeding up their decline. For families, watching an active loved one retreat into exhaustion can be devastating. It's easy to think they're just being lazy or unmotivated, but pushing them to try harder won't help. The most important thing is to understand their limits, give them permission to rest, and make them as comfortable as possible. If you notice your loved one constantly exhausted, no matter how much rest they get, take it seriously. Their body is going through a profound transformation. This is the time to cherish moments of connection, create peace, and offer support with no strings attached. In the end, what matters most isn't what they accomplish, but that they feel loved, accepted, and at ease. Next, let's discuss increased mental confusion or social withdrawal. As someone nears the end of their life, some of the most noticeable changes can be seen in how they think, communicate, and relate to others. A person who was once quick-witted and involved might suddenly become forgetful, lose their train of thought in conversations, or feel disoriented even when at home. They may repeat questions, forget names, or lose track of time, even if they never had memory issues before. These subtle cognitive shifts can happen well before the end and are more than just ordinary lapses. The brain, like other organs, needs a steady flow of oxygen and nutrients to function properly. As blood circulation weakens and the brain receives less oxygen, mental functions begin to falter. You may notice your loved one becoming easily confused, having trouble making decisions, or even struggling to recognize people and places that have always been familiar. Sometimes, there are brief moments when their clarity returns, but these are often followed by episodes of deep confusion, almost as if their mind is slipping in and out of focus. Another common change is emotional withdrawal. People nearing the end of their lives often lose interest in social interactions. They might speak less, engage less in conversations, or spend long periods sitting quietly without interacting. It's not that they've stopped caring about those around them. Rather, their brain simply can't process emotions and social cues the way it used to. Noisy environments become overwhelming, and eventually, many retreat inward and become more isolated. Along with withdrawal, there may be changes in mood or general behavior. Some people grow more irritable, anxious, or frustrated, while others seem much calmer, indifferent, or detached from things that used to matter deeply to them. This isn't just a shift in personality. It's usually the brain reacting to the declining state of the body. As mental functions slow, expressing feelings becomes harder, and responses to situations change. For family members, witnessing this can be especially painful. Watching someone you love lose touch with reality or pull away emotionally often feels like losing them before they are truly gone. What's important to remember is that this isn't something your loved one can control. Instead of trying to pull them back into conversations or snap them out of it, the most compassionate approach is to meet them where they are. Speak gently, offer comfort and reassurance, And understand that even if their words fail, your presence and affection can still be deeply felt. If you notice your loved one becoming more forgetful, confused, or disengaged, don't ignore it. These are often early signs that both brain and body are preparing for a final transition. This is a time for patience, for cherishing calm, quiet moments together, and for ensuring that the environment feels safe, familiar, and soothing. Even as words disappear, the feelings of love and comfort linger. Let's move on to the fourth sign: frequent infections and slow healing. As the body starts to decline, one of the most visible physical changes is a weaker immune system. You might find that someone who hardly ever got sick in the past now seems to catch every cold, flu, or minor infection in circulation. Problems that once would have healed quickly, like small cuts, scrapes, or bruises, now take much longer or don't heal at all. These changes don't happen by chance. They are signs that the body's ability to repair and defend itself is fading. One of the biggest concerns at this stage is repeated infections, such as pneumonia, urinary tract infections, skin infections, or even issues in the mouth. Many families view these as isolated incidents, but when illnesses become frequent or hard to clear up, it often means the body is losing its capacity to recover. Even medications like antibiotics that used to be effective may now require more time or repeated courses to work. This is because, as organ function declines and circulation slows, the body simply doesn't respond to treatment as it once did. Chronic wounds are another warning sign. If you spot that small sores, scratches, or bruises don't heal or tend to reopen, poor circulation could be to blame. Without enough blood flow, skin and tissue don't get the nutrients and oxygen they need, making healing extremely slow. Those who are less mobile are especially at risk for pressure sores, which, if left unmanaged, can become a gateway for serious infections. What can be even more concerning is that infections near the end of life often don't look the way you may expect. Instead of spiking a high fever, a senior might simply become much more tired, more confused, or lose interest in food. For older adults, a sudden drop in alertness is often the first tip that an infection has set in before more obvious physical symptoms appear. That's why it's so important to pay attention to these subtle changes, as it can make a world of difference in the comfort and support you can provide during this stage. For families, dealing with repeated infections and slow healing can be both frustrating and heartbreaking. It's natural to want to chase every possible treatment, trying another round of antibiotics or a hospital stay, in hopes it will turn things around. However, there comes a point when the focus needs to shift from curing to comforting. Keeping your loved one hydrated, protecting their skin, and minimizing stress can do more for their comfort than additional medication that may only prolong their suffering. If you've noticed these issues and you're still following along, it means you care deeply and want the best for your loved one. Now, let's move forward to the fifth and final sign: major changes in breathing or circulation. As the body enters its final stage, shifts in breathing patterns and circulation become some of the most telling indicators. You might notice your loved one's breathing becoming slower or more shallow, with longer pauses between breaths. Sometimes, their breath might speed up unexpectedly, then slow down again. Some people experience a pattern called Cheyne-Stokes respiration, in which periods of rapid, deep breaths alternate with phases of very slow or absent breathing. These changes may start out subtle but gradually become more frequent and noticeable. You may also spot signs of weaker circulation. Hands, feet, and even the ears or nose might be cold to the touch. The skin could look pale, bluish, or mottled, especially on the fingers and toes. This is due to the body redirecting blood to the most vital organs. Reducing flow to the extremities, a sign that the heart is struggling to circulate blood as effectively as before. Shortness of breath becomes more common, even with very little physical effort. Simply sitting up, talking, or shifting in bed might leave your loved one feeling out of breath. They may breathe through their mouth more frequently, or need to take breaks to catch their breath during a conversation. If they once walked across a room with ease but now struggle, their lung function may be noticeably declining. Fluid buildup in the lungs may also occur, causing a persistent cough, a rattling or gurgling sound, or even tightness in the chest. Many people assume this is just a cold, but for elderly individuals nearing the end of life, it often signals weakening lungs. Lying flat may become uncomfortable, so you may find them choosing to sleep propped up with pillows or in a recliner to make breathing easier. These changes can be unsettling to witness. Family members often feel compelled to help, encouraging deeper breaths or worrying that something critical is happening. However, in many cases, these symptoms are simply part of the body's natural slowing down process. There may not be a way to reverse them, but small gestures like keeping the room cool, using a humidifier, or offering small sips of water can ease discomfort. Sometimes, medications or oxygen therapy can provide relief, but in these final stages, the focus turns to comfort, not cure. Whenever you notice shifts in breathing, cool hands and feet, or bluish or mottled skin, take these as important cues that the body is conserving energy and redirecting its remaining resources to where they're most needed. These signs may be distressing, but they are often the body's natural way of winding down. This is an opportunity to offer your support, reassure your loved one, and create an environment where they feel tended to and safe. The most valuable things you can provide during these times are a sense of comfort, a peaceful atmosphere, and the knowledge that they are not alone as they approach the end of life. In the final months or weeks, medical intervention often takes a back seat to dignity and comfort. Being present, holding a hand, offering soothing words, or simply sitting together in silence can be powerful comforts. Even if you feel helpless, know that your presence alone has immense value. As we wrap up our reflection, let's revisit the 5 warning signs we've discussed. Unexpected weight loss, overwhelming fatigue, cognitive changes and withdrawal, repeated infections or slow healing, and significant changes in breathing and circulation. These symptoms often appear within the last year of an elderly person's life. They may not all happen at the same time, and they may not be immediately obvious, but together, they are the body's way of preparing for the final transition. It's completely normal for families to struggle when faced with these changes. The urge to resist or fight against them to encourage eating more, moving more, or powering through fatigue is strong and rooted in love. But sometimes, listening to what the body is expressing is the most loving response. Instead of trying to halt the inevitable, we can focus on making every remaining moment as comfortable, peaceful, and meaningful as possible. Recognizing these signs is not about being afraid of death. It's about being prepared for it. Early awareness allows you to make important decisions, offer the best care possible, and ensure your loved one's last months, weeks, or days are spent surrounded by love and respect. This is a time for storytelling, sharing laughter, expressing your appreciation, and reminding your loved one that they matter and are cherished right up to the very end. If you are seeing these signs in someone close to you, pause and remember you're not alone on this journey. Many others have walked this path before you. Although it is never easy, knowing what to expect can help you find strength, patience, and even peace as you support your loved one through this final phase. Thank you for joining us and for your willingness to learn about these important end-of-life signs. We encourage you to share your experiences or what you've learned in the comments. Your insights could help others who are facing similar situations, and your support truly motivates us to keep sharing helpful and meaningful content. If this discussion has been valuable to you, please consider liking, subscribing, and sharing so we can continue to reach and support more families just like yours. We look forward to seeing you in our next video.